How much do you know about psychological disorders? So I'm going to go through 11 questions with answers and respective and relevant explanations. So question 1. In the vulnerability stress model of psychological disorders, vulnerabilities are what? Well, they can be biological, psychological, or environmental factors. So today psychologists have proposed that disorders occur depending on your vulnerabilities. Perhaps you have a genetic predisposition or lack of a specific neurotransmitter, or maybe the culture you are immersed in endorses specific behaviors which restricts your identity and stresses or anything which press onto these vulnerabilities. Question 2. Two leaders of the humanistic movement were Rogers and Peirce. Now let's look at through all of these names because they're all important in psychology. So Rogers and Peirce. Carl Rogers, he was one of the founders who took a humanistic approach in psychology, one of the founding fathers of psychotherapy research, and Peirce is one of the great innovators of group therapy and Gestalt Therapy. Bandura. So Albert Bandura developed the social learning theory in response to the limitation of behavioral theories of learning. While behaviorists focus on how the environment and reinforcement affect behavior, Bandura recognized that people learn by observing how others behave, including the rewards and punishments they receive. So Albert Bandura was a social cognitive psychologist who we give credit to for the social learning theory, the idea of self-efficacy, and a famous experiment with the Bobo doll, which I recommend for you to check out. So when someone refers to Albert Bandura's approach to psychology, they're referring to the social learning theory. Bandura developed a theory that children learn by what they observe in social situations and executed a famous experiment called the Bobo doll to attempt to prove his predictions. Quick summary of the Bobo doll experiment. They had this kid watch an adult punch a Bobo doll, I think for about 20 minutes. And then they left this kid alone with this doll and they started punching this doll, even though this doll has done nothing wrong to them. They just saw someone else punching this doll and they're like, oh, okay, that must be okay for me to do. So they did it. It's interesting. Freud. Everybody knows Freud. He was an Austrian neurologist and founder of psychoanalysis, a clinical method for treating psychopathology through dialogue between a patient and a psychoanalyst. Ellis. Rational emotive behavior therapy. Albert Ellis was an influential psychologist who developed rational emotive behavior therapy. He played a vital role in the cognitive revolution that took place in the field of psychotherapy and helped to influence the rise of cognitive behavioral approaches as a treatment approach. So, there we go. Ellis is for the cognitive side of things. And Beck, also cognitive therapy. Question 3. Hilbert loves his wife dearly, but she has a compulsive side to her that sometimes aggravates him. However, Hilbert has decided that there is little that he can do to change this, and when compared to all other positive qualities of his wife, it really isn't that important. Hilbert's decision is consistent with the recent results from marital studies, suggesting that acceptance, empathy, communication, or emotional sensitivity is an important part of successful marriages. And the answer is acceptance. In this case. All the others are important. It's just those are also important, but in this case, acceptance is also an important part. Question 4. Carl is involved in a therapy group in which he is frequently asked to roleplay various people and even inanimate objects in order to gain more access to his feelings. The therapist facilitating the group is rather imaginative when suggesting activities for the group and has been known to be challenging every now and then. Carl's therapy group is probably based on the principles of which therapy? And the answer is Gestalt. So let's have a look through all of these. So Rogers, he was for the humanistic theory, and he believed in the person-centered therapy. Now, person-centered therapy, created by Carl Rogers, and this is known as a non-directive counseling client-centered therapy, or Rogerian psychotherapy. The non-directive nature of this method provides evidence that the client, rather than the counselor, can help direct the treatment process by evoking self-change. So interpersonal therapy, or interpersonal psychotherapy, IPT, focuses on improving patients' relationships, supporting their grief, and helping them to cope better through examination of life and its role transitions, any disrupted or contentious relationships, and any tendency to be overly sensitive. Cognitive therapy, CBT, what it is changing the automatic negative thoughts that you have That's all cognitive therapy is. You can read through all that if you want more context. So Gestalt Therapy, which is what Fritz Perls, Laura Perls, and Paul Goodman in the 1940s and 50s developed. And Gestalt Therapy is a humanistic, holistic, person-centered form of psychotherapy that is focused on a person's present life and challenges rather than delving into past experiences. Question 5. Clara has a phobia of dogs and consults a behavior therapist. The therapist first teaches her a muscle relaxation technique, and after she has learnt this, they create a list of increasingly fearful situations involving dogs. They start with the least feared situation. The therapist has Clara imagine it and then use her relaxation training to eliminate any anxiety that arises. This therapist is using the general technique called what? The list that they have created is an example of what? The answer is systematic desensitization and a stimulus hierarchy. I got there eventually. Survisive conditioning, aversive therapy, is one that helps an individual to forego a certain behavior habit by making use of something undesirable. So example, if you want, there is treatment for alcoholics where they get them to eat, they essentially ingest a pill that will cause them to throw up if they take any alcohol. So, this person, it's okay, it's only a pill, it's only going to make me throw up. Yes, but if you keep drinking alcohol and you keep throwing up, then you're going to be conditioned to think that every time you drink alcohol, you're going to not feel that great and you're going to throw up. So you're not going to become an alcoholic anymore because it's going to make you vomit. And that's aversive therapy or aversive conditioning. Systematic desensitization. It's the American spelling that's throwing me off, actually. So systematic desensitization. Oh no, it's Australian spelling, is it? I don't know. It's a mystery. So a treatment for phobias in which the patient is exposed to progressively more anxiety-provoking stimulant or relaxation techniques. So they just progressively get them larger and larger, probably not that large. Just in case you're wondering if spiders, they don't get that big. So stimulus hierarchy. It's written right there, actually. Stimulus hierarchy is an arrangement of responses in the order in which they are anticipated to be elicited by a particular stimulus or deemed likely to occur in a specific stimulus, also known as a hierarchy of response. Exposure therapy. So exposure therapy is a psychological treatment that was developed to help people confront their fears. When people are fearful of something, they tend to avoid the feared objects' activities, and they're using virtual reality to help people with this at the moment. So there's kind of... let's see if I put a slide on with everything that there's flooding. No, still got a bit to go, but in case you don't get the differences, just go over the slide and re-explain it. So flooding is a psychotherapeutic method for overcoming phobias. They just put the person, without gradual stimulation or a stimulus hierarchy or exposure through it, they just chuck the spider. Like if someone's got arachnophobia, they just chuck the spider on your hand and they keep them under controlled conditions. That's flooding. That sounds horrible. Can't believe that's treatment. Okay, positive and negative reinforcement. So in behavioral psychology, reinforcement is a consequence applied that will strengthen an organism's future behavior whenever that behavior is preceded by specific antecedent stimulus. I'm learning a lot of words today. This strengthening effect may be measured as a higher frequency behavior, so pulling a lever more frequently, longer duration, etc., etc. So positive reinforcement, as you can see, it strengthens an organism's future behavior through good things such as food, and negative reinforcement strengthens an organism's future behavior by bad things. So, for example, if you wanted to get your child to do homework, and every time they didn't comply, you'd whip them, that would be negative reinforcement. Positive would be giving them a cookie. So just to give the cookie, oh, there we go. There's a better explanation. So negative reinforcement would be making an alcoholic take pills, which make him throw up if he consumes alcohol, and a positive reinforcement would be giving the alcohol $100,000 if he quit alcohol. Behavior modification. So behavior modification is a treatment approach that replaces undesirable behaviors with more desirable ones by using the principles of operant conditioning. So based on methodological behaviorism, overt behavior is modified with consequences, including positive and negative reinforcement contingencies to increase desirable behavior, or administering positive and negative punishment and or extinction to reduce problematic behavior. Basically as it sounds. So what is the inability to feel positive emotion called? It is anhedonia. So dysthymia is a persistent depressive disorder, also called dysthymia. Okay, thank you. So it's a continuous long-term chronic form of depression. You may lose interest in normal daily activities, feel hopeless, lack productivity, and have low self-esteem and an overall feeling of inadequacy. So anorexia is an eating disorder characterized by restriction of food intake, leading to low body weight, typically accompanied by intense fear of gaining weight and disturbed perception of body weight and image. And hedonia, well, it's the inability to feel positive emotion, and dysphagia is a condition with difficulty in swallowing food or liquid. This may interfere in a person's ability to eat and drink. Just think esophagus. Sort of sounds like dysphagia. So all the following statements are true about PTSD, except which one? Women are less likely to develop it. The rest, civilian war victims are more vulnerable to PTSD than soldiers. Traumas caused by human actions such as terrorism, more likely to cause PTSD than natural disasters. And the lifetime prevalence of PTSD is about 17% in the Australian Defence Force. My goodness. Alright, question 8. The balance between the genetically based temperament systems, behavioral inhibition and behavioral activation that predicts depression is... So yeah, you better know your definitions. There is no MCQ strategy that's going to help you here. The answer is high behavioral inhibition sensitivity and low behavioral activation activity. So behavioral inhibition in inhabitation sensitivity. The behavioral inhibition system, as described by Gray, involves regions of the brain that are responsible for receiving signals from the nervous system which indicate that punishments are being experienced or may soon be experienced. So, behavioral activation sensitivity is appetitive. That doesn't sound right. I mean, this sounds right, I'm sure, if you read it properly. This type of motivation is regulated by the behavioral activation sensitivity, which is activated by conditions stimuli signaling reward and non-punishment, and is associated with positive affect and approach behavior. So as you can imagine, if someone, low, so they don't really feel what's it called? Looks like I need to head to bed soon. I'm having trouble reading this stuff. So if the behavioral inhabitation, I don't know if I've spelled it right, actually. So behavior, I'm going to go with inhibition, because that's what it says in the multiple choice. Responsible for receiving signals from this would indicate that punishments are being experienced. So if your behavioral inhibition system is high, that means there's lots of punishment being experienced. Right? So someone with a high behavioral inhibition sensitivity feels like they're experiencing a lot of punishment than is necessary and a lot less reward. That makes sense. Okay, I got it. It's in my head. I hope it's in yours too. Question 9. Mary has been working with a therapist because she has felt very confused and unsure about herself for the past few years. Mary's therapist is non-directive and allows Mary to explore her identity, wants and dreams of the future. The therapist is definitely humanistic, because the behavioral therapist would say, okay, well, to improve this confusion, why don't you try journaling every morning? Cognitive, she'd try to ask Mary questions and figure out what automatic thought patterns are occurring, and psychoanalytic would be asking about her childhood and, what hidden unconscious desires she might have. Types of therapy. We're just going to go through them quickly. Cognitive therapy changes automatic negative thought patterns. Behavioral therapy changes habits through operant conditioning, association between a behavior and a consequence. Humanistic therapy, a positive approach to psychotherapy that focuses on a person's individual nature rather than categorizing groups of people, similar characteristics as having the same problems. And psychoanalytic, the approach explores how the unconscious mind influences thoughts, feelings, and behaviors. Question 10. As part of a smoking cessation program, Paul receives an injection of a nausea-inducing drug, and then is asked to smoke a cigarette. Even though he knows he is receiving the drug, it is hoped that Paul will associate the nausea symptoms with smoking and will thus smoke less. This example best demonstrates the procedures typically used in aversion therapy, which we went through at the start of the video. Question 11. A drug is used to treat a psychological disorder that slows the synaptic activity of the nervous system by enhancing the activity of gamma-aminobutyric acid, GABA, a major inhibitory transmitter. This drug is probably a what? Anti-anxiety drug. But let's go through all the other drugs just so you have a vague idea. So tricyclic antidepressants, they're antidepressants. There's a chemical structure. This is psychology. But essentially tricyclic antidepressants that stop you from feeling depressed. Selective serotonin reuptake inhibitors, or SSRIs, are also antidepressants, but they focus on serotonin. Antipsychotic drugs, they manage psychosis, so essentially they're used in schizophrenia and other psychotic disorders. They are also the mainstay together with mood stabilizers in the treatment of bipolar disorder. Then, of course, the anti-anxiety drug, which slows the synaptic activity system, which slows the synaptic activity of the nervous system. So it just inhibits things. It makes you calm down, which is great for people with anxiety. They don't really have hallucinations. They're not really depressed. They're just anxious. So yes, anti-anxiety would work here. So now you know the different approaches to therapies, different medications used to treat disorders and symptoms of PTSD. I don't think I could be bothered finishing that summary. I should have been. It's very naughty of me. But essentially, I hope you've learned a few things. I certainly have by talking and explaining all of it out loud. So good luck for your exam if you're studying, or if you're just doing this for general knowledge, give yourself a pat on the back because you are now more aware of psychological disorders. Thanks for watching.